will cause and problem with the lungs, that's called as a pneumothorax, will going to damage to the lungs. If you go to the deeper level, that the apex of the lungs, you can communicate by activating this point. That's the reason it's not recommended. By the way, this point is really good point to treat for the shoulder brachial problems or the upper trapezius muscles get stiffness and rigidity, which leads to the numerous problems. That particular time when this is not radiating, these muscles having the more stiffness, that time certainly you can use this point. At the same time, this is the posterior pituitary, the anterior pituitary and then posterior pituitary. There are the two lobes for the pituitary. The gallbladder 20 also recommended, but by the way, this is in fact there are the 2 points I wanted to tell you. Gallbladder 12, this is the posterior and then inferior to the mastoid process. These are the 2 points to treat for the pituitary gland, anterior pituitary and then posterior pituitary. When we wanted to apply the special point to treat for the pituitary gland, certainly we can activate the another point called as a ear helio or the R helio. So where this point is located, this is, you just close the lobe of the ear and then with the lobe of the ear touches on the hairline. So this area where superior to the Sanjo 21 Armen, so this point is known as a ear helio. This especially this point also treatable for the pituitary gland as well. Now we wanted to use the another pituitary gland point. Of course there is, as I told you, this is the thyroid and parathyroid and then pituitary point, but this area called as a Chungsu. So you remember this is Sanjo 3 point and you are ascending to the upper direction. Take the deep breath at the base of the metacarpal bone, at the base of the metacarpal bone and then Chungsu, that is a gallbladder 3 point. This is the entire area to be treatable for the pituitary gland as well. So now hopefully you understand there are the 4 imperative points to treat for the children who are really the poor developed or the poor milestone children, especially the autistic children or the mentally retarded children, or the we can consider that mania, something connected to the brain disorders. Certainly we can use for the growth hormones or the height is not increasing to the children and less than 15 years or 18 years, it is recommended all the points to be activated. By the way, these points is the endocrine gland points, at the same time endocrine meridian, and this is in fact both the points are the gallbladder meridian points. By the way, this is really good point to treat for the pituitary gland, and being a points is located on the shoulder muscles, shoulder related disorders, especially these muscles and then these muscles, especially this called as a upper trapezius and then middle trapezius and lower trapezius, and also this is as a rhomboid muscles. So whichever it is, this muscles get stiffness, that particular time it is recommended to apply to the 1 to 1.2 chun deeper level can be advisable. At the same time, certainly when we wanted to use this point to release the shoulder muscles, that condition also recommended. And by the way, this is the endocrine point and also hormone points, especially the females having the problem like estrogen and progesterone level get it changes. Due to that reason they don't get the cycles properly. Even that condition also, when you wanted to use the hormone point in the body, remember GB21 is the hormone point. When we can't apply the needle on that particular situation, it is also recommended to give the pressure. You look at about the middle finger is touching to the upper part of the shoulder region. Then you just take this hand and touching to the shoulder, give the pressure to the shoulder region. It's give the pressure, giving the pressure itself you are activating to the hormones, male and then female hormone. Both can be regulated by activating this point, since this point belongs to the pituitary gland. That's the reason it is a super simple. Rather than giving the pressure, of course you can give the pressure, but once you can relax to the shoulder muscles, that also relaxing your shoulder and neck muscles, by the way, that is a dual advantage, is it's activating to the hormones as well. So during the pregnancy, this point is not at all advisable, right?